everyone, I am alay-ay from North Valley College Foundation Incorporated, taking a Bachelor of Science in Nursing Section A. So for today's return demonstration, I am going to perform the assessment of the abdomen. So in assessing the abdomen, the first thing you should do is sanitize your head. And then next, provide privacy for the patient by closing the windows or doors. And then, identify the client's name, age, and gender. So now, let's proceed. First, position the client in a supine position and pull the gown upward and show or expose the abdominal area. Next, auscultate for the vascular sounds and the friction roots. So in auscultating for friction roots, especially the hepatic and the splenic root, we will use the diaphragm of the stethoscope. Next, percuss the abdomen for tone, starting at the right lower quadrant upward and note for the sound from symphony and delmis. And then next, we will perform the scratch test. So we will use the stethoscope, particularly the diaphragm. So since we don't have an object for the scratch test, we will be using my index finger. Next, percuss the spleen at the left side of the patient from the mid-clavicular line halfway from the umbilicus to the side of the patient. And then next, assist the patient in a comfortable sitting position for blood percussion for the liver and kidney. So in performing blood percussion, we'll be using our ulnar surface or ulnar fist and place it in the top of our left hand. Next, perform a light palpation, noting for the tenderness, masses in all quadrant So briefly, we will do the light palpation using the fingertips of the hand 1 centimeter depth from right lower quadrant and clockwise. Next, perform a deep palpation. It requires deep palmar from 5 to 6 centimeter depth from the same pattern right lower quadrant and clockwise. Next, palpate for the umbilicus. Next, palpate the aorta using our two hands at the index finger. Next is the liver. So can you please inhale and then exhale. And then, after that, ask the patient to perform in a side-lying position at the right side and palpate the spleen using the left hand downward to the anterior part and posterior part and pulled inward by the right hand. So next, palpate for the kidneys using the left hand under the body of the patient and then right hand over the abdomen. So can you please inhale and then exhale. Inhale, exhale. Okay. After that, palpate for the urinary bladder using light palpation. Next, perform the fluid wave test. So place the forearm of the patient in the upper part of the abdomen and then put your two hands on both sides of the patient and tap it alternately. Next, assist for Roxingsa. The left lower quadrant of the abdomen and right over left, then quickly release it. And then after that, ask the patient to perform on a side lying position at left side for psoas side. And put the forearm on his side and pull upward the right leg and hyperextend it. And lastly, assist for the hypersensitivity test. So we will be using our index finger and thumb and rest the skin. So that is how we assess the abdomen. Thank you for watching.